Good evening. This is John Bailey. This is People to Be Heard, the program where people who have something to say have their say. Tonight, you've got Dr. Lata McGinn, a therapist with Cognitive Behavioral Consultants of White Plains, and she is here to give us insight into obsessive compulsive disorder. Welcome to the program.
Hi.
Thank you for coming on.
Thank you for having me over.
Right. First of all, what is OCD?
Well, OCD is a psychological illness. It's a fear-based psychological illness that essentially where you have something called obsessions. They're basically unwanted thoughts and images that sort of flood your brain, kind of like a troll inside your head telling you bad things about yourself, telling you, that bad things will happen to you, to other people that you love. And so it's sort of tormenting the person. And so as a result of those thoughts, people get very afraid, they feel very ashamed and guilty, and they do a lot of things to overcome them. So compulsions are the second part of OCD. And so that is where they develop habits, like we call them compulsive rituals, to undo those tormenting thoughts. So they might do things like repetitively, it's either washing their hands, or they might check on something, or repeat numbers or phrases, or ask for reassurance.
Yeah. How do you recognize it if you are a parent and differentiate it from normal teen behavior?
Well, I think kids do have habits, and kids do have rituals like counting and checking, so it's important not to jump to conclusions, but it is hard for a parent to diagnose it. However, if your kid is, doing things repetitively and is tormented by it and experiences a lot of distress, if they are, ashamed or secretive about it, and they are sort of occupied a great deal of the day. The thing with kids also is that, when parents who don't understand might stop them from doing something, like why do you need to clean your room, or why do you need to wash your hands, kids get very angry. So I think if there's enough emotional distress and it is impairing their functioning, I think it's time to call somebody at least to check it out.
Right. Now, you are here because on January 10th in White Plains at your offices at 1 North Broadway, you are holding a parent orientation and training night to learn about obsessive compulsive disorder. And you can get more information, if you can look on the slide that's on the screen, you can get more information by calling Dr. Michelle Greenberg at 914-385-1150. So tell me about this orientation.
So that's actually a week before the actual program for the teens. It's a orientation for parents. So they come in, they learn about OCD, they learn about the program, what to expect, how it's going to go, and then how to actually support their teens. So they learn things that they should do that is helpful for the kids. They also learn what to do that's not helpful.
Now, how do you get referred that this might be possibly a good program for your teen? It's from 12 to 18, by the way.
Yes, 12 to 18, exactly. So, school professionals call us, psychiatrists, pediatricians. People actually just look us up on the website. And so the way that you would do it is by calling Dr. Greenberg, as you said, and that way she does a quick, conversation on the phone to figure out whether this is sort of a right fit. And then after that, they come in and we do an intake assessment to figure out whether they really have OCD. It's important to diagnose it correctly. So they come in and they have that, and once we feel this would be a good fit, then we sign them up.
Now, can obsessive compulsive disorder develop from substance abuse, social awkwardness, or is it part of a person's, for lack of a professional term, psychological profile?
No, actually, it doesn't develop from substance use or social awkwardness. It's actually it's partially inherited. It's it runs in families, so it's a psychological illness, just like other anxiety disorders. So it's something that you inherit. It runs in families, but also there are things in the environment and things that you learn and behaviors that can contribute to it. There's also some neurobiological findings in OCD, so it's a very real illness that people get.
Shouldn't you, as a parent, recognize this at a much younger age than
Well,
12 to 18 time?
well, actually, OCD for boys actually starts around then, like 12 to 13.
Uh-huh.
For girls, it may not even develop. It could, but often girls will get it closer to 18 and maybe even in the 20s. So OCD doesn't arise when you are a little kid necessarily. Some do, but it's important to, when it starts, people just think, well, I just do these weird things, right? They don't realize it's an illness. So they really start doing things, and because they kind of recognize that it's a little different, they kind of hide it.
Now,
So I think it's harder for parents to just pick it up,
how does this affect their everyday performance?
A lot. It really is a tormenting illness because you spend so much time. This can really take over their day, where they might wash their hands 8 hours a day. They might, be checking all the time to see whether the gas stove is off, or they might be asking their parents for reassurance repeatedly. So this could take up really a lot of your time,
So the school performance could decline.
Exactly. School performance could decline. Your mood changes. You could have temper tantrums, so you could have emotional distress in addition.
Right. We all know how schools deal with temper tantrums. Not well.
Not well,
Not well.
yeah.
So at this point, are schools sensitive enough to OCD?
Well, I think school professionals learn about mental health conditions in general. One of the things we do at CBC is we actually train mental health professionals how to recognize symptoms and also how to treat it using CBT at the front lines. So even though they can't really implement the treatments the way we would in the offices, at least they have some tools to be able to use it with their students.
Mm-hmm. I see. So most of the school administrations in the area, you feel, are attuned to this?
Well, I would say we have not necessarily OCD in particular, but we're now in about 40 schools or so.
Mm-hmm. But so you're confident that you have a good rapport with the school systems?
Yes, absolutely.
Right. Now, is OCD growing in the teen population?
Anxiety in general is on the rise, and depression in teens. I guess OCD in particular is not on the rise. It's always been there. I mean, people didn't know about it before. So it was, there are descriptions of it dating back to the Middle Ages, really, where they didn't know what it was, and so they called it something else. But it's only the 20th century.
In asylums, but way back then. Right?
Yeah, they thought it was satanic possession. They thought it was religious fervor. There are many things. But only in the 20th century did we start to recognize what OCD is and recognize that it's an actual fear-based illness.
We perhaps might. Now, do you attribute this to computer games, Netflix, cell phone addiction, or is that a totally dumb question?
No, not at all. I think in general, I would say the social media and sort of media in general, digital media, has affected teen, emotional health, stress, anxiety, depression, things like that. In terms of OCD, it's not clear what the relationship would be specifically.
Mm-hmm. I see. Well, anyway, I'm John Bailey, and we're talking with Dr. Lata McGinn, and she founded Cognitive Behavioral Consultants, an evidence-based clinical and training center in Westchester and Manhattan back in 2004, right?
Yeah.
She is professor of psychology and director of the clinical program at the Furkhoff Graduate School of Psychology at Yeshiva University. She is renowned worldwide for her expertise in cognitive behavioral therapy and the full range of stress, anxiety, and depressive disorders. She is president of the Academy of Cognitive Therapy, past president of the International Association for Cognitive Psychotherapy. She is associate editor of Cognitive Therapy and Research Journal, and we're talking with her about the Cognitive Behavioral Consultants Winter Intensive Program for teens suffering from obsessive compulsive disorder. the clinic is in January over Dr. Martin Luther King weekend. Can you tell us about this clinic, how it works, what the children do, the teens do?
Right. So they come in, and so their parents would have just attended the week before. And so they have filled out a lot of assessments until that point. So they come in, they learn about OCD, and then they learn about what it's sort of doing, and then they essentially start creating what we call a fear ladder. And so they start to, basically, the thoughts that torment them, they learn how to withstand it and not get tormented by it. So they learn how to take the thoughts in and not avoid them. They learn how to do behaviors that actually help get rid of the OCD, so they confront them in a stepwise ladder. So much of the day, so we start in a group in the morning where they learn these skills. They learn thinking skills as well. And then most of the day is spent actually confronting OCD hands-on with the therapist.
So it's 4 straight days,
Yeah.
Friday afternoon late,
Right.
Saturday during the day,
Right.
Sunday during the day,
Yeah.
and Monday afternoon 3 to 7.
Exactly.
Dr. Martin Luther King
Yes.
weekend.
Right.
I see. Now, so basically, you have done this before. How does it work with these clients?
Well, you know, it's interesting. I've treated OCD for years and years, and you know, there's a really huge growing body of research that shows that if you do it in an intensive format like this, that it really makes a difference. So you could do that before you start weekly therapy, or you could do it in between. But sort of practicing the skills with the therapist live intensely over a period of time has really been shown to really make big gains. And then after the sessions are over, then they continue with individual therapy, so that regular practice is really important. It's like going to the gym. Like you learn how to, you know, you use the skills every week, but that intensive format really seems to make a difference.
So at this point, how many are in the group? Is it limited?
Yeah, I would say, you know, we could take in between, like, say, 5 to 8 people at a time.
Yeah, and it's run by therapists? From
Yes,
your
exactly.
organization?
Exactly, by psychologists in our practice, right?
And it is eligible for insurance? Medical
Yes,
insurance.
exactly, it is. So it's a medical sort of reimbursable, you know, payment. It depends on how much your insurance will cover and for how much, but they can always call to find out.
I see. So, if it affects persons who are in their 30s and 40s, how do you recognize this? If you're a spouse that you seem to think they're developing this, or it's getting worse,
Right.
how do you detect it?
Well,
When
no-
is a husband just being stupid and dumb, and when is he suffering from this?
Well, when you are really caught up in the rituals, you know, oftentimes spouses and parents get really caught up in the rituals where the person with OCD just won't do something, or they'll do something repetitively and ask you to do things instead, you know, for them. Or, you know, so it could be anything from not touching doorknobs, or not taking the garbage out, or washing their hands a lot of the time. So it could be, depending on how it manifests for the person, it's sort of like you're getting caught up in it.
I see, and it's making the relationship
Strained.
untenable for you.
Very much so.
Right.
It really impacts spouses and parents a lot.
Is the general medical internist able to deal with this or recognize it?
Not really. You know, actually a research study that I did with my students showed that 50% of physicians, primary care physicians, misdiagnose OCD. OCD is a
Really?
it's a
That's
very
stunning.
heterogeneous. It's stunning, really.
What do you attribute that to?
Well, it's a very complicated, heterogeneous condition. So people know, people mistake it, you know, but the most common thing you might hear about OCD is people washing their hands, but that's just one of the things. People do so many different things. It's so heterogeneous that it is really
Excessive
hard.
showers.
Well, that could be it. They could be, you know, counting things in their head. It could be very secretive. People don't know. Sometimes they have thoughts that they're sexual deviant, and so people get confused, the practitioner, like, is this person really a sexual deviant, or, you know, they don't understand it. So OCD is really a disorder of tender conscience. It's called a doubting disease. So it's something that where they doubt everything they do. So when they communicate that to the practitioner practitioner begins to doubt it. You
goes
see?
deeper. The doubt increases.
Exactly.
Yes,
They
doubt
actually
is a terrible thing.
absolutely they
If
fuel the
parents
doubt.
cannot instill confidence in their children at a young age,
Yeah.
it really affects you the rest of your life.
Absolutely. So then you begin to doubt it, and then the implications for treatment are tremendous, because then if you don't realize as a practitioner what's actually going on, you might refer them to a treatment that's not helpful at all.
Yes. Now, you helped found Cognitive Behavioral Consultants in 2004.
Right.
Why?
Well, my colleague and business partner, Alec Miller, and I founded it, and we're both doing research, and we teach, and we train, but we realized that that was not having the impact, the immediate and greater impact that we wanted. So at that time, very few people were doing evidence-based psychotherapies. So we created this really to make a difference to the community and offer treatments that have some research support. And so when we began, we started doing that, and now we also train mental health professionals in schools, as I mentioned, as well as we had a donor actually who founded a training center for us in our practice. So we now have a training center. So we want to make the greatest impact to people. That's our mission, I would say.
Do you feel educators in the classroom would benefit from this type of cognitive training?
Absolutely, absolutely.
Are they able to be? Do they get any sort of backgrounding in this in their teaching education?
I don't think that mental health education is part of a teacher's training necessarily. I'm not familiar with how teachers are trained, but I think the mental health professionals in schools do have mental health training. And so they are trained to deal with sort of issues in school, but I think schools have a lot of different requirements. So I think these counselors are really put in a tremendously difficult position. They have to do a lot of assessments, and there's a lot of different requirements. So they are not able to deal with all the kids that they see, and
parents generally are strong advocates for their children, and they don't want to deal with this. They want to support the child, but
they want to support.
Do you have to work with the parent too?
Well, I think the school personnel definitely works with. We deal with the parents when we treat them, for sure, absolutely. If they're especially under the age of 18, we always do sessions with parents as well, because we find that enormously helpful. As I was mentioning earlier, people get caught up in the rituals out of love for the person, of course, and they don't understand what they're doing. So it's helpful for the parents to be trained,
Right. Would you say the mental health of all ages has declined in ability to cope in the last 30 years or so?
Well, I would say that definitely there's more anxiety, stress, depression in kids now than ever before. I think that a lot of that has to come from sort of pressures that they face far more than we did when we were young. The schoolwork, extracurricular work, the societal pressures. So I think the ecosystem today is a lot more stressful. People don't live close to their, families, right? They're more nuclear families now. So I think that there is a lot of different pressures that are sort of stressing out our kids, I think, today. And parents, well-intentioned parents, try to help. But often they do it by trying to help too much, and they inadvertently make it worse. So they play a part, but it's not to say that this is coping skills have declined, but that could happen.
And of course, we're all dealing with the problem, we who have children, of children not wanting to listen to you.
Yes.
And discarding your information.
Of course, absolutely. Yeah, I have.
What is the best way to give advice to your child?
Well, I have a teenager.
Subtly?
Yes, very subtly. One of the techniques we use in CBT is called Socratic questioning. So basically, we ask questions and we don't offer opinions right away. We let teens come to those solutions themselves. So it's a way of asking questions.
Socratic dialogue.
Yeah.
Thank you for mentioning. That is one of my all-time favorite characters.
Okay.
Yes. at the Acropolis.
Yeah.
He helped build the Acropolis. So I
Wow.
was thinking, my God, Socrates walked here. That is the
Yes.
advantage of travel.
Yes.
It's just fantastic. Now, let's talk more about the 4-session program. You're running 4 hours at a time, January 18th, 19th, 20th, and 21st.
Right.
Martin Luther King Day weekend. Now, how will this intensive program help students perhaps display OCD symptoms? Yes, or, well, anyway.
Well, I think what happens is you see OCD in real time, right? So often when you do the 2-week therapy, you're actually, teaching them a skill, and then you're saying practice it at home and come back, right? And often kids don't do it. Avoidance is a very common reaction to anxiety, so people just don't do it. So in the beginning, having them with you in the session is really helpful because, as you said, they display the OCD symptoms to you, you confront it, you help them learn the tools, but you also help them practice it over and over again so that they really see that, wow, if I do this, eventually my anxiety does come down. Before, when you start doing these skills, it's hard because you have to face your OCD. So here you're with the therapist, and the therapist is sitting with you, and you're around other peers who are struggling with the same. And that, I have to tell you, John, that really helps them, with each other as well, because they see each other working on the skills together.
So there are like two therapists run the whole group?
Yeah, 2 therapists at a time, yeah.
I see. Now, that has got to be difficult, juggling 8 persons' individual needs.
Well,
But of course, that's why the therapists do this.
right, and
They know how to do it. How
absolutely.
do they do that?
Well, what you do, you meet in a group and you set up a plan. And then each child is given things to do. So the therapist then checks on each child as they're doing it. So they're all within the same vicinity. So it's not, very far away. So each child is sort of confronting their own demons, if you will, at that moment.
And so you do that probably on the first day.
Yeah.
And then what's the next step on the second?
Well, each day they learn newer skills, but a lot of it is, so one of the central techniques that helps with OCD is called exposure and response prevention. So they'll learn...
Say that again.
It's called exposure and response prevention. So exposure is basically confronting the things they fear. So they have to do it over and over again. So one is just learning the skills in the morning, but then the most of the time is spent actually doing the exposure over and over again. So it might be confronting their tormenting thoughts, or it might be doing things they find difficult, like touching a doorknob, or doing things that people with OCD find very difficult to do. So that's the step ladder we create. So in a sense, we're going bit by bit over their step ladder.
So when they leave, they can model starting right after the last session.
Yes.
And they return back to routine on the Tuesday after the holiday.
Exactly. So, for example, they come in, and Saturday when they start, they feel overwhelmed. They're like, I can't do this. And as they do it, they realize, oh my God, look at this difference this is making in my life. And then by the time the 4th day comes along, they're soaring, they're excited.
Right. Well, it grows on you.
Yes.
Right.
Yeah, because one of the things you have to do is not do the rituals. So when you confront things you do, the rituals, in a sense, take that away. So we help them not do the rituals.
Okay. So let's talk about the session you have for parents.
Okay.
If parents out there, if you're watching this and you are thinking, hey, that sounds like my nephew or my niece or someone in the family, and you'd like to find out more about it, or even your own child, you could go to the Parent Orientation and Training Night. Now, what do the parents learn there?
Well, the Parent Orientation Night is for the parents whose kids are starting the program. So if parents are curious about whether this would be a good fit for somebody they know or their own child, they can call Dr. Michelle Greenberg, and she'll screen them on the telephone. Then they do the intake assessment. And once we realize, okay, this is a great fit for this kid, then the parents are invited for this orientation where they themselves learn about OCD. And they learn what to expect in the program and how to support their kids. And then they're taught tools as well so that they can help then sustain it over the long
Are the
haul.
parents choosing to put their children into this 4-day
Yes.
series? Are they given materials to
Yes.
tell them what they worked on each day?
Yes, exactly.
That's important.
Yes, absolutely. They get like a summary of the day every day, and then the last day they come back for the graduation, where they learn what happened and how to then support it. And then if they're seeing somebody in our practice individually, then we tell the individual therapist. But if then the kid is working with somebody else outside, then we also speak to the therapist and tell them how to continue it.
Okay, so you can liaison with
Yes.
other professionals
Absolutely.
instead of a rivalry competitive situation.
Not at all. Yeah, exactly.
That is quite heartening to hear from my
Of course.
standpoint.
Oh, absolutely.
Because in my experience, when I was younger and I had a child that had problems, also no one could diagnose well,
yeah.
And,
It's true.
that is an understatement.
Yeah, no,
They still
absolutely.
don't, as you
It's
pointed out
absolutely
earlier.
true.
Yeah.
Yeah.
Now, we have about a minute to go in the program. Is there any particular message? There are 3 to 7 million people affected with OCD.
Yes.
What is your message to people watching that perhaps may have a child at risk?
Well, I think that if you have a child, with OCD, it's important to recognize that we are all subject to stigma about mental illness, and OCD, you just have to think of it as a medical illness. So it's like having asthma, really. So, you have a child who has asthma. The stigma is important not to be consumed with shame for your child, but to actually come and just bring it into the sunlight and actually get it diagnosed and treated right away. The CBT treatments are extremely effective, and I strongly encourage you to get help.
Thank you. Well, tonight you have been listening to Dr. Lata McGinn and talking about OCD. Thank you for being on the program, and you have been heard.
Oh, thank you, John. I appreciate it.
John Bailey, good night for People to be Heard.